Hi, my name is Susan, and I wanted to let you know what I've been dealing with for, well, probably since the mid-90s. I had RK surgery. I had it 4 times in one eye, 3 in the other. Very unfavorable results. So started my quest of trying to find lenses that could fit, that I could see through. So I was used to traveling and having different doctors see me, try to fit me with lenses. I did wear scleral lenses for about 6.5 years, and that doctor told me, Susan, never ever get surgery on your eyes again. I said, you don't have to worry. I said, I don't plan on it. So this was always in the back of my mind. But in the last 3 to 4 years, I started developing cataracts, and I thought, well, what am I gonna do? I mean, I'm not supposed to have surgery on my eyes. So I started researching, and I would go to doctor after doctor. They really did not want to do my cataract surgery. And my right one was really getting bad. So I started to hear about a Dr.Gulani, and I started researching, and I'm very much a research person. So I looked up and I was reading all about him, and I'm thinking, I think this is my hope. So I came to see Dr. Gulani, and he had such an incredible, he had this positive way about him that made me think that just maybe someone could help me. I was apprehensive because those doctors' words kept saying, don't get surgery. But Dr. Gulani assured me that he would do an individual approach. He would make a plan just for me, the way he would go in, clear up the cataract, and I thought, I'm ready. I have confidence in this guy. So we made the appointment. I was very apprehensive, but he has like a state-of-the-art, like a very calming spa-like surgery. And I do take yoga, and I pulled a lot from my yoga teachings and was completely calm. I went in there. I think I was in there maybe 15 minutes, maybe, no sedation. Walked out on my own, and Dr. Gulani's sure, Susan, I said, I'm fine. I felt absolutely, I've had corneal abrasions that have hurt worse. This was, the recovery was, and then I thought, when can I book my left eye? And so we went ahead, I went home and I recovered, and like I say, no recovery period. I felt wonderful. And so I came back and got the left eye done. And I am I think I'm a week out, maybe 10 days out from my left eye. And it has just been incredible. So I guess I want to say everybody that's had RK surgery, because I've been there, and it changed the course of my life. Like I said, I thought I was in an impossible situation. Well, after I did not come out with a good result from my multiple 4 times, 3 times, probably had 20 incisions in my eyes. I had to quit traveling. It changed my life. So I would go on the computer, and I do remember one time where I was going down this rabbit hole of people that had RK surgery did not have a good result, and they didn't know what to do. And I identified with those people. I know what they're talking about. All of a sudden I couldn't travel, couldn't drive at night. My trips during the day had to be, well, what kind of time frame are we on? I've got to make sure that I, get back by it before dark. Halos, ghosting, and then I would go in to get a contact lens prescription, and I would go to pick up my contact lens, and they would, because of the unstable cornea, I couldn't use them. So I knew I was dealing with eyes that were really a problem. So a doctor would talk to me and goes, you need to get something done about those cataracts. They didn't want to do it. They didn't know how to do it. Not that I wanted them to do it, but they would say things, and they would, oh yeah, there's people out there. No, that's not true. Dr. Gulani, when I researched him and I found him, I finally found the person that would come up with a plan just for me. Because when you have RK surgery, everybody comes out differently. And it's not a one size fits all. You have to have an individualized plan for yourself. With me, with the 20 cuts on one eye, and they weren't exact cuts, they were jagged. There was enhancements, which are horizontal lines. I was really concerned, but I am very, very happy. So if there's anybody that has had RK surgery that knows what I'm talking about, definitely give Dr. Gulani a chance to look at your eyes and see what he can come up with for you, like I did.